Hello, I'm going to be talking about the breast today. So, first part I want to talk about is the anatomy and physiology part of it. The key function of the breast is to produce and excrete milk for babies. So, these right here are the glands of the breast. There's 15 to 20 lobes, what they call lobes of the breast on each one. Um, and milk production is influenced by prolactin. I'm sorry, it's inhibited by prolactin until the birth of the baby, and then after that, oxytocin kicks in, so milk production could produce, and then the nipple starts excreting. There's three distinctive layers of the female breast, the which is the premammary, mammary, and the retromammary layers. These are three different types of tissues that are located within the breast. So the premammary layer is the most superficial, like the most outer layer of the female breast. It's mostly composed of fatty tissue. Um, it has a hypoechoic, what we call an ultrasound, which means that it is less dark than the next tissue that we're going to talk about, which is the mammary layer right here. It is the mammary layer is where the lobes are, where these lobes, the mammary lobes, where the milk production happens. That's where the mammary layer is. This layer is hyper echoic, which means it reflects more echoes of the ultrasound machine that we used. So it's brighter. So here we have an image on this one right here. As you can see, this is the retro mammary layer. I'm sorry, this is the pre-mammary layer right here on top. You can see it's darker than the mammary layer right here. This right here is the mammary layer, which is where the milk is produced and excreted towards the nipple. And then this is what we call the retromammary layer right here. The retromammary layer basically means that it's behind the mammary layer. This layer is also hypoechoic, which is less reflective than the middle layer. So it appears darker in the ultrasound machine. The next topic I have is patient prep. The patient prep. So basically what the patient has to do, have to undress, take off the shirt and bra, and put on a gown facing forward. Now, once the patient is gowned up, no shirt, no bra, the patient lies down, and then the sonographer exposes the breast that's going to be scanned, whether it's right or left, or if it's both, expose each one individual breast at a time. This is how we scan right here, the breast. Well, this is the type of transducer that we use, which is called the linear array. It has what we call high frequency transducer. The reason we use that one is because stuff that is closer to the skin, it gives us better resolution. The images are more clear. There's more detail to the tissues around it. And then I put here, as far as biopsy, basically the patient ungowns as well. Biopsies means when they're going to take a sample of tissue away from the breast to test if it has any cancer or anything abnormal from it. Ultrasound is used in guidance for biopsies. This one right here. Basically, the doctor grabs a probe or the biopsy gun, which is inserted into the tissue, and it's the one that takes it out. And ultrasound guides the needle where the tissue, the of interest, is located. And then we have here the sonographic appearances of image breast. Here we have the skin layer, which is the outermost layer of the skin, the subcutaneous tissue, which is the pre-mammary layer, the mammary layer, and then the muscle, which is the retromammary layer. Here as well, as you can see, this is the mammary layer, which is brighter than the one behind it and the one in front of it. So this right here, these three images that I'm showing you, basically, it's from the top to the bottom of the screen. So this would be the top of the screen. And this would be towards the bottom of the screen, meaning that this is more anterior and this is more posterior towards the back, towards the ribs, closer to the ribs than the other layers. So remember, this is the superficial layer, which is the outermost layer. Goes all the way down deep into the bottom layer close to the ribs. Okay, and then we're going to talk about pathologies, which these are not dangerous pathologies. These are pathologies that are normally found, with, they are not malignant, meaning that they don't spread. So we have the fibrocystic change right here of the breast. This is an image of it here. As you can see, all these little black circles are located on the mammary layer. These right here. Basically, this means that there's a fibrocystic change to the female breast. It usually happens to both breasts, but it could be unilateral, which means it's only to one breast instead of both. Some symptoms of it is breast pain, tenderness, or you feel discomfort, thickening of tissue, meaning your breasts are like hard and lumpy. There's no laboratory values that can diagnose you from this. Basically, the doctors feel your breasts, and if they feel something abnormal, then they send you in for an ultrasound. So as you can see here, this is what we call anechoic. In the middle of these, anechoic means that there's no reflections of ultrasound. The ultrasound is cutting right through it, and then, as you can see, let's say this is the top of where the transducer is, where the probe is, this one, where we put it on top. Basically, it's going through it and then hitting a tissue right below it and then bouncing back up. So all these structures don't have anything within them. They're all fluid-filled cysts, which is normal. In female breasts, it happens a lot. And then we also have a fibroadenoma right here. As you can see, remember, this is the top of the image. This is towards the bottom. This right here, this big circle right here, is the fibroadenoma. So a fibroadenoma, basically, it's a tumor. It's not malignant, meaning it doesn't spread to other areas of the body. This is the most common kind of tumor that is found in female breasts. As you can see here, it says it might feel firm, smooth, rubbery. Basically, when you palpate or when you touch the breast, you feel like a bump, and it slides up and down. That's part of fibroadenoma. The sonographic appearance of it, when we're scanning and we notice it, as you can see, it's dark, and it has a smooth all around edges all around it, which makes it a tumor. And it having smooth edges makes it appear that it's not malignant, it's not spreading like cancer. There's no laboratory values for that. Basically, it's upon feeling your breast or doctor touching and making sure that there's nothing there, and then he feels a bump, then he'll send you in for an ultrasound. And the last topic that I have is invasive ductal carcinoma. This invasive ductal carcinoma is cancer. As you can see here, this is the tumor right here, or cancer, invasive ductal carcinoma. So basically what it means, invasive ductal, the ductal means where the milk is produced, and then it sends it out towards the nipple. So this cancer starts where the milk is produced. Right here, as you can see, this one, all the edges, they're not like the fibroadenoma, where it has a clear edge all around. This one has edges like the peak, and there's no smooth, like it goes up and down and side to side and then all the way around. This is a good indication that it's an invasive ductal carcinoma. Something like this would need like a biopsy to make sure at what stage, or if it's spreading and how far has it spread. Symptoms of this is swelling of all or parts of the breast, skin irritation, breast pain, nipple pain, nipple inversion, basically where the female nipple is, it goes in instead of standing out, it goes back in. So that's an indication that there might be something there. As far as laboratory values for the invasive ductal carcinoma, there's a couple of them. The main one that I saw online is the rays of white blood cells, which means anytime there's white blood cells, increased within the body, they're trying to fight off something. So that's a good indication that there's something wrong somewhere in the body, not necessarily just the breast, but anywhere. That means that there's bones are producing more white blood cells to fight off something. So that's a good indication of it. Sonographic image appearance of this mass is undifferentiated edges. Means like I said, it's kind of like a star-like. There's no like circle or oval. It has no borders. This cancer also is subclassified. Like it's not just that type of cancer. It might fall under a different type of cancer. So that's why the need for biopsies for this need to be done. Last topic I want to talk about is the size of the breast. Size of the breast varies within age. As far as when they start producing, when their person is a teenager, the mammary layer is the most thickest layer when at present at first. Towards age, the mammary layer decreases, and then the rest of the other tissues, which is the pre-mammary layer and the retromammary layer, increase with fat. And I believe I've covered all my board here today. Thank you.